Yeah.
Yeah. Has it started?
Have you,
Let me just check in the chat window and see.
yeah, yeah, it has started now. Yeah. Great. Okay, so yeah, I was just saying that like thank you so much for agreeing to be part of this discussion, and we are really hoping that it'll be a great learning space for us as part of AICA, and be like to be able to listen to you and have great sharings. So uh, I'll just introduce. My name is Abhiti, and we have Raju with us. We are associated with AICA, and yeah, we are like since it's the transgender awareness month, so it's a great, like it turns out to be an opportunity for us to listen to a lot of experiences and sharings that the trans community undergoes, and how we as a community can function together and learn from each other's experiences. So we have Dr. Aqsa Shaikh with us. Uh, she is a medical doctor and a community medicine specialist. She's the associate professor with HIMSR, Jamia Hamdard, Delhi. She's a transgender woman and works on LGBTQIA plus rights, rights of persons with disability, and mental health. She has keen interest in medical ethics, medical humanities, and medical education technology. She's also a fellow of advanced course in medical education. She has authored many books and blogs with Times of India, Women's Web, and Youth Ki Awaaz. She's also a poet and founder director of Mizan Commercial Enterprise and Human Solidarity Foundation. Thank you, Dr. Aksa, for being with us.
Thank you so much
Now,
for that introduction.
now I'll introduce Aryan. So Aryan Somaya works with Alternative Story. He holds a master's degree in psychology with specialization in clinical psychology. His experience includes providing therapy through technology-based modes. He's a trans man who is keenly interested in working with queer and trans people. He's also trained as a queer affirmative at. He's also a trainer at queer affirmative counseling practices, and has held trainings on gender, sexuality, pleasure, and desire at academic spaces like Tata Institute of Social Sciences. He primarily uses queer and trans feminist approach and other strength-based approaches of counseling. I'll just Raju, can you please and yeah, thank you, Aryan, for being with us. Raju, can you please introduce Neeraj and sorry, can you please introduce Neeraj and Vyjayanti, please?
Uh, yes, please. So, Neeraj, welcome. So, Neeraj is the founder of Unsound Project, a user-led platform for mental health engagement from intersectional, feminist, and psychosocial perspectives. They are queer affirmative counselor at Nazaria, a queer feminist resource group. They identify as Dalit non-binary and are trained in psychology, social work, and public health research. So, Vyjayanti is a transgender human right and RTI activist precipitating public interest litigation in the High Courts and the Supreme Court. She volunteered pro bono with human rights law and social policy think tanks like Alternative Law Forum and Center for Law and Policy Research CLPR. In April 2020, she filed a PIL in the Telangana High Court that led government to supply free medicines and rations to all transgender persons in Telangana, regardless of their position or otherwise of Aadhaar and ration cards. In January 2020, she also challenged the constitutionality and the structural monstrosities of Transgender Persons Protections of Right Act 2020 in the Supreme Court. In February 2018, she got the archaic, draconian, and regressive Telangana Eunuchs Act 13295 F stayed and suspended by the Telangana High Court. Her other PILs have also extended welfare schemes like Arogyasri to transgender persons. She's a co-founder of Telangana Hijra Intersex Transgender Samiti, Queer Swabhimana Yatra, Telangana Queer and Transgender Janulu, which are unfunded and unregistered community and people's collectives of queer and transgender persons. Welcome, Vyjayanti. So, Abhiti, would you like to go ahead and start with the first question to the panel?
Sure. Okay, sure. I'll do that. Uh, yeah, so I would like to ask, I mean, we all are aware of uh, the uh, the sorry, the amnesty report that has come this year, and as the world, and the report is called "As the World Comes Together, India's Transgender Community Fights COVID-19 Alone." That's what the report says, and the government's response to the pandemic. It's also is asking for the government's response to the pandemic. So, in this context, how do you think trans youth have fared so far, and differently? Um, what has been done differently in the aftermath of this humanitarian crisis? So we'll start with Dr. Aksa. So, and I mean, we have 5 minutes time to answer the like 4 to 5 minutes time. That like we would request all four of you to go ahead and talk about this and your own experiences, and how do you think this report as a change maker or something that we can use in future? Yeah, yeah, Dr. Aksa.
Hello and good evening, everyone. I hope I'm audible uh, properly. This time, no echo.
No, no echo.
Yeah, thanks. Great. First of all, thanks to AIQA, and really, I can't start without saying it that there couldn't have been a better finish to the Transgender Awareness Month by bringing together this panel and discussing about an issue on which most people wouldn't even think twice. So when it comes to COVID, when it comes to lockdowns, when it comes to pandemics, generally people's worst behaviors or best behaviors come to the fore. And we have seen as a society, how the human behavior has really been highlighted through all these almost a year of pandemic that we have been through now. So generally, we say that the society is judged by how it treats the weakest members of the society. You know, so when it comes to one of the weakest members of the society, there is no doubt that persons with disabilities or persons with different gender identities, or as we call transgender persons or intersex persons, these are the persons who are generally in the lowest ranks of the society. They are the most underprivileged, most disempowered. And the way our nation, our societies have treated these most underprivileged sections of the society is something to be observed, to be written about, to be talked about, and to take a learning from them. So when the pandemic came, and in its wake also the lockdowns came in the month of March, of course there was a big crisis where people didn't even have food to eat. Forget about finding a mask or a sanitizer or even worrying about vaccine that we are doing now. And in all these times, we have seen that how one of the weakest sections of the society have been neglected, including the trans population. And a lot of persons in the transgender community did not have opportunities for education, for employment with security during such critical times. Many of them, especially from the groups like the Hijra community, from the Kinnar community, those who are persons involved in sex work, people who are involved in begging also, these are the persons who were most affected during the pandemic. And we have seen how many trans persons had to literally beg, borrow, steal, I mean whatever things they could do just for simple food. We're not even talking about admissions into hospitals or preventive measures or treatment or anything, just for the simple sake of food. And the response by our government, um, even on paper, does not look good. Forget about in reality on the street. Even on paper, they've literally done nothing. Through the PDS or through provision of direct benefit transfers or any other forms. So yes, during these times, the trans youth has been one of the most vulnerable communities, one of the most affected communities. They had to be holed up with their violent families. A lot of people who were undergoing transition had to stop that due to various reasons. And when it comes to the healthcare and medical terms, I can only tell you by one statistic that there is no statistic for how many trans persons have been infected with COVID in India. If you go to any of these portals and data sites and all, they generally have males and females or the binaries, and these binaries have been more strengthened during the pandemic. We just do not have data for how many transgender persons were infected. At the most, in some forms, you have a column called other, in which all the trans persons and all those persons, intersex persons, and other persons who do not wish to be identified into male or female are supposed to be bracketed. And this otherization of the transgender or the intersex community is what we had to undergo during these pandemic times. And there is absolutely no further data, or no analysis, no publication, no research findings on how trans persons were affected in terms of healthcare, in terms of COVID, or what responses have been done, or how things could have been done. So this just as a community have been totally neglected by the government, whether it comes to the provision of simple basic things like a train travel or food stuff, or when it comes to even provision of healthcare. We have isolation wards which are male wards, female wards. If I'm not comfortable in either, or if the other people are not comfortable in either, or due to any administrative reason, I don't have a third place to go into. So it's like there is complete invisibilization, otherization, and neglect of the trans community. Yes, over to you, Abhiti.
Thank you, Dr. Aksa. Uh, I would request now Aryan to talk about like what he thinks about the report.
Sure. I am not really aware about the report, unfortunately. Uh, but I do because I myself have got COVID. So probably I
Yeah.
would be one of the persons in the report if there was anything, you know. Because the
Hmm.
first question that I also asked when I got hospitalized was, do you guys know or have you ever worked with somebody who is trans person or Hijra community or anybody from trans community? So the doctors were completely unaware, the nurses were completely unaware, and it took me some time to come out to them. Like I couldn't come out to them on day one. I had to come out to them to the next day because it's important. Because I am on hormone replacement. So gender affirmation surgeries. I get not done surgeries, but I am on hormone replacement. So the purpose that it serves is so basically one of the side effects of hormone for female to male transition is thickening of the blood
Hmm.
because of testosterone. And unfortunately, in the COVID also the first sign that comes up is thickening of your blood and starting to clot. You know, so it was very difficult to have a conversation with the doctor. Thankfully, I spoke to my endocrinologist, and my endocrinologist told me before only that I'm not supposed to take testosterone for another till the time I don't start recovering. And then the next day when I spoke to my doctor who was treating me for COVID, also told me the same thing: to not take testosterone for another month or 2 months. So the kind of lack of awareness and the lack of what do we call is initiative, initiative
Hmm.
from the hospital, from medical health services or systems is has always been an issue for transgender community. So it's not like it's anything new to be if brutally I'm saying that, but the truth is brutal, unfortunately. So it's not like a new thing that like we are going through, the community has to go through. So I believe that you do the report or you don't do the report, the truth still remains, you know. So that is that.
Mm-hmm.
But I'm very happy that both like my nurses and my doctor, both are very much at least open to the idea of discussing this, which I was very scared of, you know, to have a discussion that will they be accepting me, because I was supposed to be in the hospital for 8 days with my parents as well, and that was very difficult because I knew that if I don't get treated well, or anything that goes wrong with me will have a direct effect on my parents' mental health, you know.
Mm-hmm.
So yes, of course, and luckily, or I don't know how, but I was placed in general ward. Like all the three of us were placed in general ward because there was no space in the hospital for different wards or special wards or private rooms. It was only available was general ward, and all of us were together, man, woman, like binary people, cis people, and I was the only one who was trans, you know.
Mm-hmm.
Um, and I mean, I don't know what to say because at that time I had no other choice but to but to just conform to whatever is coming through, because you wanted to get fine, you wanted to recover. So whatever was
Yeah.
happening, I was just going with the flow. Unfortunately, I didn't have that privilege only to say that okay, this is what I need to speak about. This is what is the kind of treatment that I want. This is what I want. So, and unfortunately, there's no data available. Whatever treatments these people are getting, trans people are also getting the same medication, you know, same medication, same amount of medication. But there was this one time, so in this treatment, I don't know how many are aware, but I would still say, I'm sure a lot of people are aware about this treatment. They give blood thinning injections, you know, every day, one
Okay.
injection every day. So I had to tell them after 3 days that there's something that happens to me after going with this blood thinner, because I actually kind of started having psychedelic effect. The whole uh, like I was feeling dizzy, I was feeling like I'm flying in the air. All of those effects started on me. So I had to tell them to reduce the dose, you know. So, but before that, I
Mm-hmm.
had to ask them, is this something that you feel happens to people? And they had no answer. Unfortunately, there's lack of initiative, lack of research, lack of also sharing information is what I feel. I'm sure that there are so many people who got hospitalized. So even if, so for example, if I am the one who got hospitalized here, I wish they pass this information to other hospitals. It's okay if you don't have a very big research, and I understand that COVID is very new. To have any kind of a expecting like we need to have a very big research on this, but at least as basic information as your lived experiences with a trans person, because if
Mm-hmm.
I'm treated over there, at least they can pass this information to nearby hospitals if nothing else, you know, so that if
Mm-hmm.
anybody else is getting affected, they can be treated that way. So I had to tell them
Yeah.
that यार मेरे को लगता है कि आप ना इसका डोज कम करो, बिकॉज मेरे को सूट नहीं कर रहा है, मेरे को अजीब मेंटल हेल्थ
Mm-hmm.
इफेक्ट हो रहा है. And unfortunately, I'm also on mental health medication since last 3 years, antidepressants and anti-anxiety. So I'm on both intersection,
Mm-hmm.
mental health intersection also. So I had to tell them that also. And fortunately, they were very open towards mental health medication, and they didn't. Like they didn't shame me for going through mental health medication. So I think I was quite lucky in that way, that I also got
Mm-hmm.
doctors who were very open to have a conversation, and another one is also not pill shaming me for mental health medication, you know. But
Mm-hmm.
yes, overall I feel that this information is something, it's okay, I feel sometimes it's okay if you do not have very big research to show, but at least little things, because research is something that can be done later also. I mean, academically अगर आपको जाना है तो आप कर लो बाद में, but जो जो तब भी हो रहा है, at least वो information तो pass कर सकते हो ना. As little as somebody who was on hormone therapy had this issue, how difficult is that? Like these smaller steps are also very important to be taken rather than larger researches at this point. You know, like
Hmm.
immediacy is something that you need to look at rather than seeing कि अच्छा मेरे को अभी रिसर्च करना है. ये सब आप कंपाइल
Hmm.
कर सकते हो और बाद में तो बांट ही सकते हो. But this is something that is immediate. Immediate. You find this person having this issue, do this, pass the information. You found somebody who is
Hmm.
on estrogen, take see what is happening, read what is happening, देखो क्या change आ रहा है, pass it on. This is the immediacy is what I'm talking
Hmm.
about. Passing the information
Hmm.
not only through writing medium but also oral medium. We
Hmm.
always are so dependent on written mediums. So I feel हम इतना ज़्यादा उसको importance देते हैं written medium को, any knowledge. So I want to say there are other ways also to share knowledge, not like share or produce knowledge, and one of it is oral medium. Lived experiences at that point. So that's what I always want to say, that this is what we lack in knowledge production, is only giving one way of producing knowledge, which is in written form, not on the oral form.
Hmm.
So that's what I feel can bridge the gap with mental health and physical health difficulties. So I feel this is what we need to,
Yeah.
because I know the report, maybe AQA report is very, makes you just helpless. Like I was even hearing all made me feel so helpless, but I want to be more hopeful, you know. So hence I'm saying this is
Hmm.
something
Hmm.
that I'm looking forward to. And I also understand it that it's not easy to have written form of communication all the time. But something like this, which
Hmm.
can help you to do immediate, like helps you to take immediate action, is very important. Is something that we lack as a system, you know. But
I think
please
it's
correct me if I'm
also
wrong.
what no, it's also what you were mentioning yesterday during your conversation with
Yeah,
Raju, that how community engagement, like what we were trying to implicate somewhere, like how community engagement is so important, it's so relevant that like instead of just writing and putting things in words, because everybody may not have a language to put things in words. So how much oral communication and uh, communicating as a group and working as a group is
yeah,
so important at
absolutely,
different stages. Yeah.
absolutely.
Uh, so yeah, thank you. Neeraj, would you like to add anything and like put your own experience and your knowledge into it?
Sure. Thank you, Abhiti. Thank you, Aryan, for sharing your own experience. Uh, I think Abhiti, I think like the title, right, of the report, India's transgender community fights COVID-19 alone. I think I am very much invested in the history and the medical history, and I think we just need to learn from the history that has been the case for always. So it has nothing changed. So it's a when the HIV movement came, also we know it how the countries were fighting for the medicine. People could have been saved, but it was very intentional idea to not save people, and who
Yeah.
should die should be saved. So I think we are living on the blood of a lot of marginalized population. We talk about whether racial, religion, whatever minority. I think it is the same, and I think I also very unfortunately, I feel it will also be this way, the kind of a political scenario that we are living in. So, I think invested in the history of medicine and history of just generally how things have worked. I think it's a very, very dark history that we need to just keep reminding ourselves when it comes to medicine and what is that happened. And I think also what Aryan, Akta, I think I'm with them, but I think also I always just think that these were also very pre-COVID cases, right? We don't have data on
Mm.
transgender persons and what's happening. It's also made it in a very this asylum of HIV, STI conversation
Yeah.
most when it comes to MSM, hijras, transgender, as if, and that has become this sort of a notion of the sort of a population, and then suddenly you don't talk about LBD population, and then when you talk about trans persons, then you're just suddenly thinking, wow, what is this trans person doing, right? So I think I wanted to bring this part, when we're talking about trans youth. What do we mean by that?
Mm.
See, trans youth is not in an isolation, right? This trans youth is going to college. They are Dalit trans persons. There are people, those who either, go in the surgery, during the surgery, were, it's a very clear case that trans persons, they do not prefer to stay with their natal family because the family is the first point of violence. Of course, it
Yeah.
one say that, whether it's a general statement or not, that's debatable. But yeah, that has we have seen it, right? So I think given the condition when we have this pre-COVID disasters over non-binary trans folks just generally, right? The life was difficult even before COVID, and I think the COVID just made it more terrible because
Yeah.
you had to go back, and you had no choice to just stay in your flat. You had no choice to go and just say that I have assignment, or I have anything that I want to stay with my friends. You had to go back to your parents. And I think as I'm sure Aryan must can add also, like I think as MHPs we had received so many calls during this COVID time that there was such a high distress call. We literally have to intervene. Crisis support was so at the high. Nazaria, where I work also as a counselor, crisis support was extremely high, that people were saying, and it was across the identities that I want to speak: cis women, cis lesbian, bisexual women, trans persons, across it. So one is to acknowledge it. Ki what I think it also didn't change a lot. I think just everything came upfront a lot, with the COVID. Second, I think my second intervention is I have to bring caste and occupation. That again, the trans youth was not only employed in the fancy jobs, right? Most of the trans persons, when we talk about also, right, uh, they're Dalit, right? They're also probably, they're living in this sort of identities where they express themselves very differently. They're cleaning roads, they are into sweeping hospitals and etc. And I think I'll make very controversial statements because this was all by my own personal experience when I was interacting with some of my friends that I met who works in the India's best institutions, right? And I'm sure Aksa can also add it to it that what was going when Aryan was saying building academic readings, right? They were very much
Mm.
invested in that. They were taking this as a guinea pig sort of idea, and you're forgetting the
Mm.
tree. And I remember I was speaking to this surgeon and I was like, did you really have less of PP kids? They're like, it was never short of it. And
Oh.
like we always had PP kids. We had like enough of it. But then you have to bring caste, you have to bring hierarchy, right? Sweepers was not getting it. The people, those who were
Mm.
burning the dead
Absolutely.
heart, right? These are the precisely the Dalit Bahujan population, those who are doing this kind of a work, and they get exposed to that such a place in that sort of a situation. Also, like this is the very important narrative. You also will have trans youth there. It's not that the trans youth are not there. Maybe we need to
Mm.
read our point of view, right? That the vulnerability increases at that point of a time. So I think sweepers didn't get PP kids with nurses. When in Bombay we saw it at the intensive when they were protesting that. So I think that notion I'm really interested in, that कि वहाँ पे क्या हो रहा था और वहाँ पे it was really miserable in that part. Again, I think for me the personal part of it, when your question is that what has been the aftermath or something. And I think the only thing, because I've worked before this in HIV field and I'm connected to a lot of CBOs, and I think in Delhi, Noida, I've only seen it, or even in Bombay, I've only seen it. CBOs, which are community-based organization, directly supporting communities. So it was not the state which who was intervening. It was only Hijra trans persons, those who were going and distributing rations and everything, right? See, that becomes a very tangible thing because we need to sustain it every day. And and again, also now we're talking about this population also, which when you talk about sex work or other part of it, then there are other morbidity of health conditions that one is also exposed to, which has its own political economy altogether, which is you have it and we don't know how successful certain things are happening. And I think I know so many calls that I received, and one of the things was this again, right? That a very young trans person, a very young trans person was actually kicked out of the parents' house. And and, and
Hmm.
and I'm sure there would have been many trans kids that we don't know the narrative. I know
Yeah.
one, so I'm just sharing it at this point of a time. And you know what? I think that is a very helpless condition at that point also, as MHP, as whatever you want to call it yourself, because then you have lockdown, right? You can't travel a lot. You don't have those certificates, right? That you can go out and can intervene. Also, police. So I think these are the challenges. I think I can just share it out and loud, which has been my own journey within during COVID times. That, of course, later the child was taken back, right? And I'm saying child because this person was underage, right? Uh, and
Hmm.
imagine a somebody who had to, as a just because this person wore a lipstick, their parents threw it out in that time, and it's COVID times. So nothing has changed. So it was very COVID or not COVID, it was more sort of a more and more difficulty for trans person. So without a doubt, I think it has been a long journey.
Hmm. And
Over.
actually, during this time, I mean, a lot of shelters, I mean, a lot of spaces that were generally available for support were like they were mostly like online spaces, and like there were no offline spaces, and physical spaces that were really available. So
Yeah,
that it continues to be a difficult time. I mean, it continues to be a very difficult journey for a lot of people, like who
yeah.
are from trans. Yeah,
And even when thinking that if the question comes up that you have a question on allyship and etc., I would just like fund trans organization directly, fund individual people, give them shelter, give
yeah.
them. It is really important. Don't think so that like we need places that where we can send children or like young people to stay, because that becomes a very immediate that what we need. We probably, of course, we can do other advocacy work, but those were the things that I think came up very suddenly. So yeah.
Yeah. Yeah, thank you, Neeraj, for sharing your experience. Now over to you, Vyjayanti. Please share your learnings and your experiences of at least like with the report that you have seen around.
Yeah, can you hear me?
Yeah, yes.
So, the I largely resonate. I mean, I almost resonate entirely with all of you. And the situation hasn't been any better or different here in Telangana. Telangana is the state where I live, and it yet has a common capital for. I mean, it's kind of the population of people from Andhra Pradesh too live here. Um, Although they have a new capital, it's an over um, the it's a floating population. So now there are themes across which transgender persons' lives, I think the lives of most marginalized, disenfranchised, marginalized, and vulnerable communities are affected, particularly transgender. Family, unlike, unlike a child born into, say, a religious minority family or a Dalit family, where the child has to be born to at least one parent who is from the religious minority background or a Dalit background, the transgender non-conforming child is not necessarily born to gender non-conforming parents. So that family as an
Mm,
institution isn't really available. Across other themes like, say, for education, livelihood, employment, healthcare, Medicare, um, housing, public accommodation, public utilities, these tend to overlap with other disenfranchised communities, also pan out differently. Now, coming specifically to COVID 19, uh, I sometime by the end of March, beginning of April, I had a flood of calls from many people. It started off with 5, 6 people, and then eventually it went up to nearly 50, more than 50 calls, and I wasn't able to talk to as many people, because I'm just a teeny weeny activist. I don't have an NGO. We don't have a call center. So, and I realized that there are many transgender persons and even gender non-binary, gender non-conforming persons, and these terms like transgender don't really fit in well into our Indian rural societies, because there's the identity of Koti, which is very amorphous. A Koti person
Hmm.
could at times be could identify as gender non-binary, gender non-conforming, or sometimes as a trans woman, and that's a very amorphous identity. So there were very many, quite a few Koti persons who called, who were from time to time identifying, if they were on assignments with NGOs, they were kind of obliged to identify as male sex workers, but they may not have identified as male sex workers, may have been transgender sex workers. So, and there were some transgender and Koti ex-sex workers who had by then gotten into some form of full-time employment at cinema halls as usherers, at supermarket. I mean, sorry, at some malls as staff and so on. And through the lockdown, these places were shut, and some or many of these people were immunocompromised. They were HIV positive. And some of these people hadn't accessed the public healthcare system for free HIV medicines. Because there's this fear, and there's fear. I've known activists, let alone non-activist transgender persons and Koti persons. I've known activists who don't want to access the public healthcare system that distributes HIV medicines for free, for the fear that their status will come out, because part of the staff and the personnel in the public healthcare system, not all of them are government employees, some of them are from NGOs, and these NGOs are
Hmm.
CBOs, I mean community based organizations. So the fear is, oh, that CBO head is my adversary, and that person is going to let the word out that I am HIV positive, so I don't want to go to the government hospital. So there were a huge number of such people, and those people, quite a few of those people, were at the end, were at their wits' end to cope with this, because they until then were accessing their Medicare through private healthcare, spending some 1,500 or 2,000, and out of the blue, they couldn't go out. There was a lockdown, and they can't immediately get registered under public healthcare, because if you recollect, in April, May, and June, the public healthcare system, right from dermatologists to endocrinologists to, even dermatologists and people who had nothing to do with internal medicine or respiratory diseases, infectious diseases, all of them were sucked into COVID. Government hospitals,
Hmm.
largely government hospitals became COVID centers of excellence, right? So for about through April and May, dispersal of ART was a circus. It was a impossibility. Things got streamlined only by the end of May. During that time, the already immunocompromised persons who were out of the ART medicines, already some of them had got infected. The others were under intense fear that they're just 20 yards or 1 block away, or the next door neighbor, entire family is infected, and I'm out of my ART medicine since 2 weeks, 3 weeks. I don't know how immunocompromised I am. So that fear was mounting. At that point of time, uh, we drafted certain representations to the government, and we wanted the government to come under pressure. I gave at least 2 representations a week, did it 3, 4 times, and finally, and the communities are also not out, and not for no fault of theirs. We live in a society, the kind of society we live in, we all know how sexophobic, transphobic, and patriarchal societies they are. So they want out to their own families that they're transgender or Koti. So you can imagine them even telling their families that they're HIV positive. We had to move up
Yeah.
right then and there. I waited only for about a week or 10 days, gave two representations. There was a standard system generated response. I didn't get any response beyond that, and we moved a PIL. The effect of which was, I mean, the judgments are great, but what about the implementation? The High Court took immediate notice of that, and it ordered that right from rations to medicines that cover hypertension, diabetes, HIV, ART medicines be supplied to those persons who are already registered, and even for those, what about those who are not registered? That those
Yeah.
unregistered people be registered. And that now some of them wanted that registration to happen in their homes because they were at red zones and so on. Some of them did not. Many of them did not, because imagine a group of PPE wearing team of healthcare workers descending on your home. Whether or not you're COVID
Mm.
positive, the whole neighborhood will think that you're COVID positive, right? So they didn't want people to come to their homes. So the High Court gave a brilliant order wherein they said for those who want it at their doorstep, it should be provided to their doorstep based on their requirement. And for those who don't want it at their doorstep, it should be at a mutual place of convenience, be they the government hospitals. And what about red zones? So for red zones, the court gave specific orders that there be designated spaces in red zones. But what about implementation? All this looks lovely, brilliant on paper. The implementation was a far cry, was a far cry. As our colleagues and co-panelists brilliantly put it out, as Dr. Aqsa Shaikh and Neeraj and Aryan Bhai put it out, the marginalized are the most vulnerable while community medicine, preventive medicine is for the disenfranchised, marginalized, and vulnerable. But when large decisions are being taken, the most marginalized of the marginalized, the most invisibilized of the marginalized, they're not even seen on the radar. They're not even a speck on the radar. So it was a circus to get that implemented. Um, Thankfully, the lockdown cleared by June. Thereafter came the question, and after the lockdown cleared, till the lockdown, Telangana hadn't erupted like Delhi and Bombay. After the lockdown, we realized that we were sitting on a volcano. It just erupted. Within a week, it erupted here. And during that time, many transgender people got infected. They were just being refused admission, like how men and women were being refused admission. And while in government hospitals, they are required to have separate wards for male and female wards. These were no separate wards, they were all mixed up. And even where there were
Mm.
separate wards for women and men, we have had documented cases reported widely in the media across states of sexual assault by COVID positive male patients over COVID positive female patients. We've had those cases. So imagine a transgender person, pre-op transgender person being sent into a male ward. You can imagine the horrors that could unfold there. So the court gave specific directions that transgender persons have separate transgender wards. How was the implementation? A far cry. Where the few
Yeah.
transgender persons who got admitted were yet sent to a male ward. And when we insisted, then they said that, you see, but then we'll find you a dark alley, nook or cranny. Don't complain if the healthcare workers come only once a day, because we have high traffic. We will go here 3-4 times a day. There we don't know. Don't even ask us if we don't come even once a day. How do we document all this? This is happening
Yeah.
there, and I can't go there because it's all cordoned off and it's a COVID red zone. I can't go there. And our people are telling us on video WhatsApp calls. Yeah, they're showing us.
Mm.
So we yet went back to the High Court. The High Court was very, very, very supportive, the Chief Justice's bench. It kept this case open until now. I don't think the case is closed even now. And it held weekly hearings. The Honorable Chief Justice held weekly hearings. The Honorable Chief Justice wanted status action taken reports week after week, and pulled up the government. There were quite a few eggs on the faces of the government every week. not here to save any government or any privileged, powerful power lord. We are here for our communities. We are accountable to the most marginalized, the most disenfranchised persons in our communities. So the judgments were brilliant, but the implementation was a circus. It was a circus. Then, speaking after Medicare, post, even those who were discharged, you see, they were pulled initially. They were pulled out of their slums, their ghettos. They were pulled out with a whole horde of PPE wearing vans, people going there. So the whole locality knew. When they were discharged, they were not given any negative report. So when they were sent back, the whole ghetto or slum was demanding, like, how the hell do we know that you are negative? We are not going to let you come into this now. So there had to be a lot of community engagement to say, भाई साहब, आज इनको हुआ, कल आपको हो सकता है, कल मुझे हो सकता है, किसी को भी हो सकता है, भाई साहब, जरा इंसानियत को बाकी रहने दो. So a lot of community work had to happen there, and fear was raging at its peak. Even now, I think the fear has come down to a small extent now. People who died, like, I mean, people, imagine people who died were, they were not, their bodies were not being treated as human bodies. Their bodies were being treated, I'm sorry to say this, but they were being treated like some excreta, like some excreta. We've had deaths here of transgender persons, but nobody, and I don't blame them, I don't blame them at all. Nobody wants to admit that this could have been because of COVID. The stigma has been so high that even when a 40-year-old person died, they overquoted the age a little bit, and they said, oh no, she was already 55 and she had sugar, and she has been weak and all of that. And I don't blame them. That's because the environment has been so surcharged. The stigma of getting this unknown disease has been so high. On the one side, the medical ailment on at many levels, and on the other side, the psychosocial stigma around it. And you can imagine how severe it would have been, like how our friend Neeraj spoke, how severe it could have been for those who are multiply marginalized, who could be Dalit, who could be Dalit persons with disabilities, Dalit persons with disabilities who are HIV positive. If you look at our friends, sisters who are sex workers, a large number of them are Dalit, and a large number of them are immunocompromised. Yeah, a good number of them are also Muslim, religious minorities. So the interplay has been lethal. The way COVID has, we felt as though we were trying to fight with a multi-headed hydra whose each head, when chopped off, each drop of blood that fell was creating so many zillions of hydras.
Yeah, thank you so much for shedding light on these experiences and these really like how like even if after High Court's orders and multiple interventions, like how implementation still remains a very difficult task. Like it remains a challenge for the community to actually make it
My
happen in
apologies to
real.
interject here. My apologies to interject.
Yeah,
I just want to add one point, and I won't take more than a minute.
yeah,
During this
please.
time, the
Yeah.
High Court, the Honorable Chief Justice's bench, instructed the State Legal Services Authority. We got the Nalsa judgment from the National Legal Services
Mm,
Authority. So they instructed the
mm,
State Legal Services Authority to do a comprehensive study. In in June they instructed, and they said within 2 weeks do a comprehensive study of the transgender population and the living conditions, the difficulties, challenges faced by the transgender populations in this COVID pandemic. It was issued by the patron in chief of Telangana State Legal Services Authority, who's none other than the Chief Justice. And the member secretary issued that directive. It went to all the district legal services authorities. The report, through an RTI, I got that report, which is a shame. It's an egg on the face. When the Telangana new state was formed, the comprehensive integrated household survey said that while there are population of Telangana is 4 crores, and while there are 2 crores 10 lakhs of men and 1 crore 96 lakhs of women or something like that. It said very clearly, out of the 33 districts, the population as of July 2014, 6.25 years ago, the transgender population was 59,991. That's 9 short of 60,000. When the High Court told the District Legal Services Authority to do a comprehensive study, can you imagine what figure they came up with? It wanted the population as well as the living conditions. It had to be quantitative and qualitative. They gave a 6-page report, did a study across 10 districts, and gave a population of 12,000. Who are they trying to fool? Who are you trying to pull over whose eyes? 6 years ago, and 2011 census, in the unified state of Andhra Pradesh and Telangana, the transgender population as per the 2011 census was 43,000 chillar something. The bifurcation happened. It would not have been equally distributed. Andhra Pradesh has a bigger coastline and many more cities. It would have been 21 and a half to Telangana, 21 and a half to 1,000 to Andhra Pradesh. We may have got 15,000 or 20,000, and some 23,000 would have gone to Andhra Pradesh, assuming that the base figure of, as per census 2011, was 20,000 in Telangana. By 2014, 1 month after the Nalsa judgment, it leapt by threefold. From 20,000, it became 60,000. And now, who are they trying to fool? That after Nalsa judgment, when a few more, I won't say that the Nalsa judgment has majorly impacted everybody and everybody's out in the open. I won't say that. But things have marginally improved. So if before, pre-Nalsa, if it fold in 3 years, from 20,000 in 2011, it became 60,000. In 6 years after Nalsa, should it not have increased sixfold? I think it would have easily become 2 lakhs by now. The 2021 census, if it's held on time, will show. And the Telangana State Legal, and one of my RTI questions was, please submit the minutes of the meetings of the conferences or consultations, webinars, or whatever you held to get this data. The RTI reply says, no consultations were held. Where the heck will you get this data from? You doctored it yourself? Who are you trying to cheat? I'm done. Sorry.
Yeah, thank you. Yeah, thank you so much for these additional points. I mean, these are really relevant, and how challenging, like how many challenges the community may continue to face. And Telangana has always seen like a surge of cases, of HIV, and trans community obviously it's at the verge of it. And during this particular time, it's really hard, that what has been going on and how much it is difficult for the community to deal with the challenges. So taking forward what already has been discussed, but I would still want to raise this issue and hear all of you on this particular. I mean, we are aware that there continues to be violence and discrimination against religious and caste-based minorities. So, I mean, I would really like if you all can share your lived experiences or your interactions that you have with the community to help us understand how trans community has been affected at its intersections, especially during the pandemic. So yeah, we'll start with Dr. Aksa, and yeah, I'll just request to to keep the time, because we really want to listen all of you and make sure that all the questions are addressed. So yeah, Dr. Aksa.
Thanks, Abhiti, and it has been really a very engrossing experience listening to the talks by my co-panelists. Right from at individual level, how someone feels that justice is not done. That something good could have been done in that opportunity when a transgender person is a COVID patient also. Right to how the states are unjust to the transgender population. So it's like discrimination at every strata, at every level, from micro to national level. And in fact, when Aryan was talking about his experience in the ward, I remembered my own experience, because I also was having COVID a couple of months back. I was admitted in a female ward, um, female staff, hospital staff ward, because I also work in that same hospital. for a period of 10 days. And in spite of, being working in that institute for 7 years now, and in spite of me having transitioned physically a couple of years back, my treating consultant and physician did not know about my history. I'm saying, okay, don't
Mm.
assume, and you may not be knowing about it, you may be someone new, but it was all written in the case paper, and I ensured that my medical history is written and taken properly and noted down by the resident in the paper. But the consultant unfortunately didn't care to even read that, or make themselves aware of that, and therefore they weren't aware that I am on hormone replacement therapy. They weren't aware of the kind of surgeries that I had gone through. In fact, on the 10th day, the consultant became aware that I also have high blood pressure. You know, so, and remember this, that I am an associate professor who works in the same hospital, and in terms of hierarchy, I am in fact even senior to the doctor who was treating me. And in spite of that,
Mm.
such amount of neglect can happen during these times. And we do empathize, since we are also healthcare workers, that during the COVID times things do become more difficult, especially when you are in PPE. Communication can become difficult, and a lot of other time management things become difficult. Doctors, providers, and the patients both are going through their own mental churnings and anxieties, and all those things are understood, but then one cannot compromise on basics of humanity. So when
Mm.
we talk about asking people about their preferred names, or asking about what is the pronouns that they want to be addressed with, I mean, we can't even think of that if a doctor does not even care to find out if I am on HRT or not, or it does not even care to appreciate that my patient is a transgender person, and their needs may be different, their physiology may be different, their anatomy may be different. In fact, when it comes to the question about how the double marginalization could sometimes take place because religious minorities and caste minorities, and then coupled with the pandemic, how things could become worse.
Yeah.
If you remember, in the end of February, we had Delhi riots in northeast
Yeah.
of Delhi, in which more
Yeah.
than 50 people have lost their lives, um, from both the communities, and we have many people whose houses were burnt, who have become disabled for life now. And me and my friends were doing a lot of relief work for them, when suddenly in a month later, that is in the end of March, the lockdown was announced. And
Mm.
during that time, as I also mentioned in the initial part, that the basic necessity was food. And I do remember, how some of the NGO partners were trying to cater to the transgender community in trying to provide them ration. But then is unfortunately so invisibilized, at least to the mainstream providers, that they didn't know how to approach the transgender community. Where do they live? Where do they work? How to find them? Or how to talk to them. I mean, these are certain things which many people from the general population, so-called general population, are not even aware of. And we have seen how migrants have suffered, and there were millions of migrants who had to walk home barefoot with their children, with their belongings. We have seen those scenes. And weren't transgender persons also part of those काफिला जो एक गुजर रहा था, जिसको हम कहते हैं उर्दू में. So of course they were part of that, but then there is so invisibilization. I'm sure you might not have seen even a single media house trying to find out what happened to the transgender community during these times. Where are
Mm.
those Hijra persons who were begging on the traffic signals? Where are they now? How are they earning their
Yeah.
bread? How are they dealing with the crisis when there is lockdown and there are no traffic signal opportunities, to earn money? So this
Yeah.
basically shows the lack of concern of the government on one part, and also of the population. And even when some groups and communities had good intentions and wanted to help out, I mean, the distance was so much, I mean, distance in terms of understanding and knowledge, that they didn't know how to help the community persons. And one thing I would really like to share, that a lot, which a lot of people shared with me, is that generally, the image of the transgender community is that you are beggars on the signals, or you are prostitutes. Though I don't like using that word, I mean, this is how we get addressed, the persons from the transgender community, unfortunately. Or we are dancing in the weddings, or on giving badhai or something of that sort. And sometimes they are really amazed to find that there is a transgender person who can also be a doctor, who can be a medical teacher, and who is running, um, um, fundraisers. And fortunately, we were able to raise 7 million rupees during these times
Wow.
for food relief. And they were like, "Ki, how is it possible?" So what I'm trying to say, that the disconnect is so much that it is difficult for them to believe that a trans person can also be empowered and can help cis persons also. So it's
Hmm.
generally, like, you expect that the upper caste Hindus will help the Dalits, but it's very difficult to digest, that a Dalit can run a fundraiser for the Brahmins, for example. So I mean, this shows that how much, our society needs to evolve in terms of its understanding. We have recently seen, how if a farmer speaks good English, that cannot be accepted
Yeah.
by the media houses. I'm sure if they'll hear me or Vyjayanti speaking English, they'll start fainting down. They're like, okay, how can you speak English in spite of being a trans person? So I mean, that's
Yeah.
the expectation level. So yes, there has been a lot
Hmm.
of multiple minority stress during the lockdown times, and Neeraj has fleshed that out really well. Ki how sometimes we don't even think that the class 4 worker in a hospital who was denied PPE was also a person of Dalit identity or caste, for that matter.
Hmm.
So absolutely a learning experience for me, actually, to listen to all the panelists over here. So over to you, Abhiti.
Yeah, thank you for bringing out the pogrom that happened in the in northeast of Delhi, because that has been a really traumatic experience for a lot of people. And expecting a trans person to be affected by it because of their religious identity, and or they can be empowered enough to help and support the community at such a level, is obviously that a lot of people are just do not willing to accept. So thank you for shedding light on that. I mean, Aryan, would you like to share your thoughts on that?
Absolutely. I mean, thank you, everyone. I'm learning so much from this discussion. But that also gets me to this one very important point, which I totally forgot, was, you know, when we talk about trans community. Um, Let me also tell you this. Matlab, this may sound very brutal, but people, do transgender community even consider trans men as trans? you know None of the reports or none of the persons here have ever spoken about what it is about to be a trans man. Trans community has always been about trans woman, and forget about
Hmm.
non-binaries, you know trans men and like non-binary population. And it is so heartbreaking to know that the only thing that people care about is trans woman, you know and
Hmm.
and it's so painful that none of I don't think even one research on trans community has ever even counted trans man in their research study. And that's what I felt by hearing to all of y'all all the time. Like, I not only y'all but everybody. It's just that right now it triggers, when you're listening to reports and nobody even mentions about trans men population. And you know so none of the reports that I know have had any conversations or any mentions about trans men. And that's what I want to talk here about. If that's what I that's what clicked me when I was thinking all through,
Hmm.
when I was listening to all of this, all of it. And no doubt I loved what the conversation was. But what triggered to me was this absence of even counting, considering trans men as trans population, and so
mm,
it's like marginalized within, I don't know how many marginalization. One, the whole marginalization of being born with, the born, nahi, I don't want to use born, but female assigned at birth. That is one
mm,
marginalization that already happens to a very huge, वो तो एक अलग ही fight है, मतलब that is so
mm,
there only, and then super marginalization within the trans community itself.
mm.
And then, of course, like Neeraj mentioned, is about caste and class marginalization. So the
Yeah.
number of marginalization that a trans man community goes through is far more worst, because I
Mm,
feel, and this has been in everything, not only in medical system but in every system, because I was denied of taking testosterone. I was not able to get testosterone. I was not. None of the doctors were ready to give me injections because they considered this as a non-essential service of taking hormones, or and even if now, right now, then let's talk about gender dysphoria. How can we forget
yeah.
about gender dysphoria? And at
Yeah.
these times, where and I would still say that access to community at large is still not the community. We do not have any
Mm,
communities like Kotis or Hijra community or Kinnar community or etc. etc. I don't say that it's that somebody else is privileged, like Hijra community is privileged. No, but I'm still saying that as basic collectivization का भी हमारे पास opportunity नहीं है. you know um, कोई भी मीटिंग्स में ट्रांसमैन का कभी भी ये नहीं होता है, ट्रांसमैन और नॉन बाइनरी पीपल का प्रेजेंट रिप्रेजेंटेशन नहीं होता है, इट्स नेवर
mm,
रिप्रेजेंटेड. सो आई वुड वांट टू से दैट सिस्टम हमारा तो एक बेसिक visibility is only so challenged, you know
mm.
are just like to even a space to come out is so challenged. हमारे
Yeah.
पास तो वो प्लेटफॉर्म ही नहीं है. Forget about accessing anything else. We are not even considered
Mm,
as trans in transgender umbrella, you know and I've seen this. I have had experiences. Actually, I never wanted to get this here, but I it just triggered so badly to me today that I have been with people, where I have gone for research. I have gone to speak with other people, and always trans men को दबाया जाता है, उनके नीड्स को
mm,
दबाया जाता है. But this is fact. I have felt it. A lot of my friends, like trans men, have felt this कि हमारे ही कम्युनिटी में हमको एक्सेप्टेंस नहीं देते हैं, कि आप तो मर्द नहीं हो.
mm,
That is the first thing that
mm,
people have always told, and it is coming from everyone,
mm,
from the trans community or non-trans community, where people say that आपके
mm,
पास तो, like, I don't want to use these words, but yeah, let's just get factual here because everybody is talking about so many facts. कि आपके पास तो dick नहीं है, आपके पास तो penis नहीं है, so you're not man
mm,
enough. तो वो एक basic acceptance from the community itself is so missing. Forget about having a
mm,
community support, for trans population. So, this is just coming from my heart, but I think it was important to speak here. मतलब हम लोग, I have seen, like Neeraj also mentioned, कि yes, with a mental health practitioner, yes, the number of calls, number of trans men population reaching out to me is like huge, is humongous, the
mm,
kind of people who have reached
mm,
out. उनके लिए तो इतना एक्सेस करना, अपना आइडेंटिटी को ही एक्सेस करने में so much difficulty to just. I have seen so many people who reached out to me saying, भाई आपका वीडियो देखा, सर आपका वीडियो देखा, आर्यन आपका वीडियो
mm,
देखा, तो ऐसे लगा कि हाँ मैं भी ट्रांसमैन हूँ. तब समझ
mm,
आया कि जो मेरा एक्सपीरियंस है वो ट्रांसमैन है. सो द बेसिक
mm,
नॉलेज इटसेल्फ इज मिसिंग. एंड सो आई फील कि वो बेसिक प्लेटफॉर्म ही नहीं है. Forget about creating more platforms on other systems
yeah.
like medical, mental health, economical systems. I've seen so many trans men losing jobs, you know.
Mm,
Um, then so many people I have seen because of pre-transition, like, pre-transition or non-transition. I want to say that transitioning is a huge privilege, to access
mm,
healthcare or access even transitioning is a huge privilege. It's not just a choice. इट्स अ ह्यूज प्रिविलेज. सो बहुत सारे जन है जो ट्रांजिशन के बारे में सोच भी नहीं सकते, कमिंग फ्रॉम ट्रांस मैन कम्युनिटी.
Yeah.
तो वो
Yeah,
चीज
thank
के
you.
वो
Yeah.
मतलब
Hmm.
वो चीज
Yeah,
के
please go ahead.
हाँ, मतलब वो चीज के लिए भी हमारे पास एक्सेसिबिलिटी नहीं है. आई नो हाउ डिफिकल्ट वी फेस. सो दिस इज द ट्रांस मेन कलेक्टिव दैट वी हैव जस्ट फॉर्म दिस,
Hmm.
लाइक बहुत ज्यादा पुराना नहीं है, बहुत नया कलेक्टिव है जो हमने शुरू किया है. वी हैव नॉट इवन रजिस्टर्ड, इट्स जस्ट 3-4 people who are very much interested to work just for trans men community. हम सब सारे ट्रांस मैन हैं. सो डिफिकल्ट कि मतलब अगर हमको मीटिंग भी करना है तो नहीं कर सकते, बिकॉज फैमिलीज में लड़कियों को अलाउड नहीं होता घर से बाहर जाने के लिए. you know so you
Hmm.
see the kind of marginalization that starts just as a basic identity, as basic identity as born in female bodies, or a gender
Hmm.
assigned female at birth. I don't want to use like female bodies, but gender assigned female at birth. हम तो वहीं से ही लड़ रहे हैं. Forget about even
Hmm.
accessing trans men as an identity. Like I mean,
Yeah.
you getting my point. This may look uh, very much illusional when I'm talking, but this is the fact for trans men community. तो उस और कोविड के टाइम पे it becomes all the more difficult because मैंने सुना है, मतलब I have heard stories from my own trans brothers who have spoken to me about
Hello? Aryan, are you still there?
I'm so sorry, I was just getting a call. uh,
It's okay. Yeah.
मैरिज के ऊपर बात कर रहे हैं, जबरदस्ती मैरिज करवा रहे हैं, जबरदस्ती प्रेगनेंसी. I've seen so
Hmm.
many men who are unfortunately married, you know, I've been forced to procreate because that's the job
Hmm.
of, person assigned female at birth, you know. तो हमारा जो मार्जिनलाइजेशन और अब्यूज और वायलेंस है, वो तो हमारा बेसिक आइडेंटिटी से शुरू हो रहा है, यू नो. मतलब
Hmm.
वो आइडेंटिटी जो हमारी है भी नहीं, वो भी हम सहन कर रहे हैं. दैट्स द पॉइंट. you know I still
Yeah.
feel people assigned gender at birth as male still have an upper hand than people
Hmm.
assigned female at birth, क्योंकि हमारा मार्जिनाइजेशन तो वहीं से शुरू हो जाता है. फॉरगेट
Hmm.
अबाउट ओनली हैविंग अ ट्रांस आइडेंटिटी. वो तो बहुत लेटर का बात है, वो तो हमको एक्सेस ही नहीं.
Yeah, it's actually like what I could gather from your experiences is like it's also very difficult to to identify yourself
Yeah,
as a trans person, as a trans man,
yeah,
because that identity itself is so invisibilized. Like for someone uh, who has experiences or who has uh, you know. Like it's difficult for them to even identify themselves as a trans man. They may
absolutely.
think themselves to be a lesbian woman or like someone
Yeah,
who is more masculine, but they are
yeah,
still a woman. Like, but to identify themselves as a man is itself is a journey to
yeah,
undergo. Yeah,
yeah.
that yeah. Thank you so much for shedding light on that. And Neeraj, do you want to share your like your clients who must have spoken to you about their experiences and and even your own experiences at an intersection of caste-based community and from a queer community. So yeah, please over to you.
Yeah. I think it's also very good what Aryan has sort of brought it up, because it also gives me sort of this another platform to take it and sort of problematize this Brahminical very say set patriarchy, because also we have
Yeah.
seen it. It's also, see, what has happened with the Brahminical sort of idea is that it has not only been the only the Brahmin head man who has been
Mm,
very against, or has been only violating a lot of things, but it has been across the identities, right? So it's the same within the queer identity, queer movement. We have seen it how who is desirable, who is not desirable, who gets access, who doesn't get
Yeah.
access, who is part of a circle, who is not part of the circle. So I think that one, and I think that has been just the constant case, I think, is just generally. So I think, let's say, even if you have SC/ST atrocity acts, if you have, some of the scholarships to be supported and everything, but who are these Dalit trans men, right? Who are these Dalit trans women that you will see, right? You have very few, right? There are very few,
Yeah.
and in, let's say, even I know with so many of my Dalit queer friends, when we speak, we always say like, who can raise funds, who can come for
Hmm.
this
Hmm.
meeting, right?
Hmm.
Can speak the language of
Hmm.
intersectionality, right? You need to
Yeah.
go, you need to first of all read, reread, and and I think it's with the same religious minority, right? Within the caste equations, within the Muslim minority, right? That who gets access, who doesn't get access. So I think I want to just
Yeah.
like sort of start problematizing it, when we talk about Dalit, Bahujan, Adivasi, trans persons, whether men or women. I think that there's this entire setup, like, of course, there's this entire setup which is against them. And anybody who
Hmm.
is come from the Savarna ideology, I go for it. I say that you will violate one day, and you do,
Yeah.
right?
Yeah, you
So
do that. Yeah.
so so you will, and like that's the same. I think I just want to reiterate this part of it, that the caste is also so ingrained, right? Like, because see,
Hmm.
gender is also, we are talking very beautifully these days, because this queer is a neoliberal thing, right? Like, it's a great, you become a
Hmm.
West product, you become a new liberal product, you become this first
Hmm.
world person, right? When you talk about queerness, trans identities, है ना? But when
Yeah.
you have to speak about
Yeah.
Indian identities of Jogta, what Vyjayanti said, the Hijra terms around Kothis and etc., or what Aryan is saying, I think agree to it, that what are the terms that we have in Indian context, right? For lesbians,
Hmm.
bisexual women, what are the terms we have? We don't have, right? That shows the entire idea of
Yeah.
patriarchy, that how phallic centric it is. But I think this phallic
Yeah.
centricism is only not independent of caste in India. It's very caste
Hmm.
oriented, it's very Rama oriented. So
Hmm.
also, just to put it
Yeah.
out that Dalit queer bodies, Dalit trans bodies will keep we keep on getting rejected from that part of it. So I think, what when you speak, when you're saying about Hathras, or when you're talking about Delhi riots, right? So
Hmm.
I think it was very interesting in the way to just locate it, that I think the way the Dalit community, sort of, I can say the Dalit queer community came together in a one form or another form. I can speak about it. Like, I think for my own support circle was my Dalit queer community. Honestly, I think I was ready that I will not go for anybody else. Like, I think
Hmm.
we
Yeah.
knew it, that we need to be there for each other, for that part
Hmm.
of it. When the Hathras thing happened, I have a friend who is from Hathras, and when this thing happened, of course, there was lot of conversation we had it, and etc. There was this entire gaze of that who is going for protest, who is not going for protest, right? And then you become this symbol of, right, that this कि आप जा रहे हो नहीं जा रहे, आप क्या कर रहे हो नहीं क्या कर रहे. But I think
Hmm.
this conversation, I am really interested in that, कि ये क्या होता है उस समय, right? This entire idea, because once when you're living those lives, right, that,
Hmm.
because certainly, like, one is the media piece, right? But suddenly when you're living those Hathras atrocities, like, I live in a Dalit colony in Delhi, right? And and
Hmm.
when Aksa was talking about, her with the the medical experience, and I was just like really interested in the part of it. With Unsought, we always say that the entire typical user and medical doctor perspective, like, there's a complete
Hmm.
power hierarchy. They don't treat you as a human being, they treat you as a subject, right? Like, that they're supposed to just
Yeah.
they know the best, so you don't have the any say. And I think this is the same with the Dalit bodies which have happened, and it has happened throughout years. It keeps on happening, it will happen, right? Where we just
Hmm.
suddenly, to just become a neoliberal product of queerness, we miss the Indian identity, because that's the real identity, right? But you may not want to go
Yeah.
for it, right? Because we are just
Hmm.
so busy being
Hmm.
neoliberal. So I think these are also the consciousness that I want to raise in this specific part of it, that what is really happening in this entire intersectional debate also.
Mm.
One, I think again, BT, just to answer it, that in terms of what was specifically was happening with the trans person, I think I didn't see it specifically that how the Hathras or other things was happening because uh, of course they were fear for sure, they were fear for sure that that something can go wrong, something can go miserably wrong. I have some of my clients those who
Mm.
are come from activist circles, so there was lot of fear, and I think there was a lot of fear. So, and I think there is no
Yeah.
other that I can just say there was fear, and there was like strategies to what to do. See, also you need to understand the COVID was used as a political tool to go against activists. It was
Yeah. Yeah.
it is a political ground at the moment. It is no more a pandemic. I think I differ
Yeah.
when people say it's a pandemic. I'm like, I'm sorry, I really doubt about that. It is it at the moment, or I really doubt if
Mm.
politicians take pandemic as pandemics. I think it's us
Mm.
doctors or friends, when we lose some people, then we realize. I think that is my
Yeah.
major thing I always say. So during this time, what was happening? I think people were scared that you can't see what happened, right? We're talking about amnesty report, but amnesty was shut.
Yeah. Exactly.
Amnesty was shut. The human rights organizations were shut, and I remember talking to some of my clients, and I'm like, can we just try to reduce certain work because probably we don't have lawyers right now to fight your
Mm. Mm.
and I think I literally remember, having this conversation, talking to my friends that, who will fight. They went against students, they went against, many young
Yeah.
activists, they went again, and, we never know who they are, how they identify because the identities are very personal to it. So one,
Yeah. Yeah.
um, I think the one thing I really just want to say, which I think people have just because rape as a tool, right? Rape as a tool, rape as a
Mm.
political group, rape, however we want to say, like in queerness, right? With the across the LGBTQI spectrum, we have seen it that there is this idea that we have also normalized it, some sort of it, because it's in exchange when it's come to bullying, or one gets the it has very normalized that it's a part of a queer life
Mm.
that you might be sexually objected. But I think that is something I think in COVID increased so much. So I think it was, I think, at the peak that where I think people have lost. I think we have lost some of the queer people, trans persons because of that. So that's, I think,
Yeah.
that or otherwise I think what Aryan was saying in terms of the forceful rapes that they do. They call it, I don't know, the corrective rapes, the term that they use it against LBTs, and I think that has had increased intensively, immensely, a lot also during this period of a time.
Yeah,
So I think this
that's right.
this this conversations had to be, because again, see, it's a phallus centric, it's a very Brahminical
Yeah.
ideology again, right? So your intercaste
Mm.
marriages, intercaste love didn't fall apart. Your interreligion, didn't get disappear in between. It was all
Yeah.
happening, and then for the
Mm.
family, it was a moment to show you, right? That
Mm.
we can show you how to control your bodies. So
Yeah.
I think these are the my points only, but of course I think there was this fear about that, how to get help in terms of लॉकडाउन है, आप lawyers के पास जा सकते हो नहीं जा सकते, who will be your lawyer at the first of all moment, right? Because lawyers also went through
Mm.
immense stress during this COVID period. period.
Mm. Mm.
So I think
But
this
I
is
think just talking about stress of lawyers or like people who are already in enough privileged spaces, I mean, it's the last thing that I mean we should be thinking about. Like I mean, that's their
but
job to support
Abhiti,
us.
but what about the trans interns, right? Trans interns, those who were
Yeah,
going and doing the lot of work. Like I think
yeah,
that is what I'm saying. That this trans youth is everywhere. They are a medical
yeah,
and
yeah,
they are
yeah.
the law forms, law
Mm,
rooms. They are everywhere, right? So it's not that there is only
mm,
one section, right? जो हम बोलेंगे कि trans है.
yeah,
So I
yeah.
think that
True, true, true.
I think yeah, these are my thoughts on that. Yeah, thanks.
Yeah, thank you, thank you. Vajanti, would you like to shed some light on that? Vyjayanti, can you hear me?
Yes. Can you all hear me
Yes.
now?
Yes.
Firstly, I have no shame to apologize to Aryan that um, trans the issues of trans men weren't raised until uh, he spoke. Uh, at the same time, I'd like to also clarify that we also don't, because as a uh, panelist who is a trans man, you may didn't really want to co-opt an issue that Aryan is the best representative of when there is a representative on the panel. Now that that's been raised, I would like to specifically point out to I have friends who are trans men in Telangana, and um, many of them are people of multiple marginalizations, quite a few of them, purely for the sheer fact that they have confided this with me without outing any of their identities. And this is not about Telangana, but about Andhra Pradesh and spread out in the south. Uh, these are trans men who are multiply marginalized by caste, by class, and disability as well. And many of, if
Hmm.
you look at a government disability hostel, any government disability hostel, bulk of the inmates are Dalit and Bahujan, either SC, ST, or OBC. And um, some of our trans men who were there were under enormous fear because government was trying to, if you notice, many of the shelter homes were shut down, many of the custodial homes were shut down, and even victims of trafficking were sent back to their respective homes from there where they were trafficked for the fear that COVID will explode. So the here as well, the government was trying to shut down disability hostels, and on government disability hostels, there's a huge pressure. There are newer people wanting to get in, and the kind of fear that trans men face in those government disability hostels, if they are Dalit transgender persons with disability, is that, oh, I can't be out here. Because if a trans man were to say that I'm a trans man in a government disability hostel meant for women, which is already under pressure. There's a long queue of other women with disability wanting to get in. The fear is that they will call me a man and they'll say, ये मर्द कर क्या रहा है यहाँ? औरतों के
Hmm.
हॉस्टल में ये मर्द कर क्या रहा है? इसे बाहर फेंको.
Hmm.
Because there's already a queue of women with disabilities waiting for years to get into the disability hostel. On top of that, during COVID, during COVID, uh, the government was keen to shut them down because it feared that it will be accountable if COVID explodes in those disability hostels, right? So this issue, no community is unitarian or monolith. In as much as I am a trans woman, I'm also an OBC, other backward caste trans woman. I cannot co-opt the Dalit narratives, but at the same time, I cannot shy away if my Dalit friends are telling me to offer solidarity. Yeah. So there
Yeah.
is a intersectionality is quite complex. And we
Hmm.
need to know where we must step back, and we must also know where we must not shy away and offer full, complete, unconditional solidarity. There are times when we have to stand side by side. There are times when we have to step back. There are times when we have to stand at the forefront and ensure that people who want us to stand ahead of them are well protected. So it is quite
Yeah.
complex. Nothing, absolutely nothing is binary.
Yeah, thank you. I mean that these are some really like how the allyship somewhere functions. Like you literally tried to bring it up. So thank you for that. So like we are really short of time. So I'll just quickly go to Raju to like to talk about the next question.
Uh, Thanks, Abhiti. So this question is addressed to Dr. Aksa. Now that we have discussed the impact of pandemic on trans youth, when we look at trans community in terms of the age groups, so the pre-adolescent, adolescent, and post-adolescent trans youth differ variedly in terms of their health requirements. So how has the pandemic affected the provisioning of healthcare to these different age groups, considering how their requirements are also variedly different?
Thanks, Raju, for that wonderful question. Because generally, when we speak about trans persons, we generally speak about 18 plus or adult trans persons, and the minor trans are generally ignored. In fact, even if you look at the WPATH guidelines, which are for gender transition or gender affirmation procedures, to be more correct, or for that matter, the medical interventions that are being done in the transgender persons, we speak of only persons who are mostly about 18 years of age. And there's a small chapter, on the pre-adolescent or adolescent trans persons, because it's felt that these are the ones who are a no-go people. You can't touch them, you can't do anything about them, very sensitive. But then those of us who identify ourselves as trans and those who know about the trans persons would appreciate that that is the phase actually which is one of the most critical one. I mean, any person who has been through puberty as a trans person, the first puberty or the natural puberty, would understand that it's a horrible or a traumatic experience to see your body becoming something that you do not identify with. And at the same time, the kind of emotions that you are going through, you are getting attracted to people whom you think you should not be getting attracted to. And that time there is, even if I don't talk about the gender affirmation services part, there's an immense amount of requirement for the counseling services or mental health services. And we have seen during the pandemic how the provision of mental health care and the mental health services, including, I'm not talking about psychiatrists alone, including by those who are psychologists or psychological social workers, has decreased, because of course, lockdowns and other stuff. And even later on, not everyone has access to internet. Many of the trans persons in our country won't be able to see this panel discussion that we are having because they may not have access to a recorded version of this. So that's the kind of lack of privileges that we are talking of. And especially during this time, I mean, what Neeraj has spoken of and Aryan has spoken of, because both of them do a lot of counseling work, is that a lot of trans youth, especially the minors, were in need of counseling services, were in need of help because of certain crisis, and they could not get it. The calls that have been connected to Neeraj and that connected with Aryan are the ones which were successful calls. These are the people who ultimately could speak to Neeraj and Aryan or to someone else, Vyjayanti, for example, that matter. But there are many unknown trans persons who didn't even know that a Neeraj or an Aryan or a Vyjayanti exists, and to have access to their phone numbers or to get in touch with them. So even when we look at
Absolutely.
all these stories, ki, oh, this person was in crisis and this one person was thrown out of the house, there may be many other people who might have been thrown out of the house and whose stories will never be talked about. So there has been an immense lack of mental health care services for the trans youth even before the lockdown, and that crisis became more aggravated during the lockdown. In addition, we have seen that the gender affirmation services literally collapsed during the lockdown. A lot of trans persons who are even adults and who are on hormone replacement therapy. For example, I am myself on a hormone replacement therapy. Aryan spoke about his hormone replacement therapy and how that was disrupted either because of lockdown or because we became COVID positive and it had to be medically stopped. And trust me, all of those who have been on HRT and who have stopped HRT in between due to any reason for a period of a month or so would know that that gap, when you suddenly stop taking HRT, is emotionally very, very traumatic to deal with. Because then suddenly, your hormones level drop and your, testosterone or estrogen start taking over, and that can be very dramatic. And during that time, you don't have access to your endocrinologist, many of them,
Absolutely.
and you don't have access to psychiatrists or psychologists or counselors for that matter, and you're more concerned about dying of COVID, so you start even questioning your thoughts. Is it even right? Am I in the right mind to think about my HRT now when I am suffering from COVID? Shouldn't I be more worried of dying of COVID, than about my transition? So even start questioning yourself, and these are
I
things,
love this.
these are the things, probably which only people who go through this can, appreciate, how you start questioning your own
Absolutely.
sanity, and कि क्या भैया लाइफ में क्या ज्यादा important है, जिंदगी ज्यादा important है या transition ज्यादा important है. We know, I mean, transition is a life saving thing that you actually undergo, and you can't speak about
Yeah.
it to, even your friends, even if no one asks you, even your
Yeah.
friends who know that you're COVID positive will ask you about your breathlessness and fever, but no one will ask you, okay, you stopped HRT, so how are you feeling, so I mean, there are
Yeah.
so many subtle, unsaid, unspoken stories of all these
Absolutely.
traumatic experiences that we will never even appreciate, forget about talking about them, discussing or finding solutions to them. So, especially in the adolescents, they go for puberty blockers. These are again in the form of injections which have to be taken every 3 to 4 weeks, and they are very costly. Each injection can cost almost 7,000 rupees for that matter in the private sector. Of course, in the government sector, it's just not available. And even getting that injection, even
Okay.
if you had the ability to pay, you cannot get that injection during the lockdown times. So it's like a complete disruption. But then even if you look at the situation now, when that disruption happened, a lot of parents, the power equations became the parents becoming superior to you. It's like, okay, now you've lived without these drugs for 6 months, you might as well try and get rid of your addiction of HRT. You know, so it's like, there's always a battle which is happening between you and your family. Trying to negotiate this transition process, and this was the time when suddenly their side became more strong, and it's like, okay, now drop the idea. See, you can live, in the gender you were assigned. There is actually no need to transition, and all these, and you don't really have people to talk. I mean, though, we can speak on WhatsApp groups, we can speak on online, but then there's nothing like actually sitting across someone you trust, and sharing what's in your hearts. So this is just a glimpse of the crisis that the trans adolescents have faced during this lockdown. And the current situation is no rosy at all. Yeah, over to you, Raj.
Thanks, Dr. Aksa, for actually clarifying those questions that we had. I think a lot of us, a lot of those unsaid stories, those untold tales of the trans lives, which are pre-adolescent, those young kids who are still inaccessible to any of these healthcare provisions. Yeah, the suffering is unreported and it remains the same. I think what has been is just an exacerbation of the current situation. Yeah. So,
Yeah, I'll just put the next question to before Aryan. So the psychological support structure vary widely for like pre-adolescent, adolescent, and post-adolescent age group. So how best can we provide support to trans youth in these age groups with with the heightened dysphoria which is existing? Aryan, you need to unmute yourself.
Yeah, I think I missed the question because there's some
Okay.
disturbance. I was not able to hear you. Could you please
Okay, I'll
repeat the
just repeat
question?
the question for you. Yeah, I do that. Yeah, so I was
Mhm.
asking that the psychological, psychosocial support structure vary widely for pre-adolescent, adolescent, and post-adolescent age group, and how best can we provide support to trans youth from these age groups
Mm,
with heightened dysphoria?
mm. Sure, sure. Okay. Yeah, so this is again, like I always say, the question has so many layers. There cannot be one answer to this. And I mentioned
Hmm.
this also in my yesterday's talk, you know, that
Hmm.
how how it is such a multi-layer and a complex form of issue, you know.
Hmm.
So, when you say about youth of our country, I think youth of our country is the most neglected or taken for granted crowd, population,
Hmm.
because there's only one thing that is taught to them is to focus on your education,
Hmm.
if they have access to.
Yeah.
Second thing that is been told to them is to take forward what their family are doing.
Hmm.
The more like the least form of agency that a population has is this population, adolescents,
Hmm.
and the least amount of sex education, gender for that matter, is least to this population. I feel extremely agitated when I am seeing um, adolescents reaching out to me with so much frustration, so much anger, so much oppression for that matter, and the kind of non-accessibility and non-mobility to even access
Hmm.
basic mental health care. Because
Hmm.
parents, if the children even trying to say, and this I want to say, this is like happening to the most privileged population, you know, where parents are saying, "Arey, tu to pagal hai." Anyways, mental
Hmm.
health is seen as you are mad or you are mentally ill
Yeah.
or you are mental,
Hmm.
for that matter. So unfortunately, imagine, and I always would start with privilege because um, वहाँ पर जो problems है ना वो सिर्फ worse होते जाते हैं with more intersection with caste and class. So imagine if this is on the highest hierarchy पे ये issue है. Imagine the worstness that it may happen when it goes to the lower hierarchies. You know. Uh, so
Hmm.
um, uh, so I and I feel one solution to this has always been as community, because जो
Hmm.
बड़े services हैं as mental health service or medical health service, all of these services are first always made for privilege. It always
Hmm.
starts with
Hmm.
privilege, and unfortunately, this is a very westernized understanding of accessibility or solution making or healing. I always have to, like, I've always हम बोलते हैं ना, पैसा लगाना है, मतलब that's the worst thing that you would say, but if you want to bet on something, bet on healing. So I always believe community education, community, so community से शुरू करो. As large,
Hmm.
what is the need of that community? And this is
Hmm.
one basic understanding that all communities, regardless of caste, class, gender, section, ये होना चाहिए बेसिक. हमको एक ये बनाना चाहिए कि हर एक इंसान को ये चीजें मिलनी चाहिए. राइट टू दिस जो है हमारे कॉन्स्टिट्यूशन में, ऐसा नहीं है कि नहीं है, बट अनफॉर्चुनेटली उसका एप्लीकेशन, लाइक नीरज स्पोक, लाइक वैजयंती of us is talking about how it is not executed well. ऐसे टाइम पे जो गैप को हमको ब्रिज करना पड़ता है ना, उसको कम्युनिटी का सपोर्ट लो, बिकॉज कम्युनिटी, हम वी हैव ऑलवेज बीन वर्किंग एज कम्युनिटी. We have always worked as community, we have always operated as community, as culture. तो उसका हमको
Hmm.
फायदा उठाना चाहिए. We always need
Hmm.
to see that how the things that are inaccessible is then created accessibility by community. you know जैसे
Hmm.
अगर हेल्थ केयर
Yeah.
सिस्टम है, आई रिमेम्बर वन ऑफ द हेल्थ केयर सिस्टम दैट इज बिल्ट, आई डोंट नो, बट वन ऑफ द सदर्न स्टेट्स ऑफ आवर कंट्री, वेयर जहाँ पर आईज के ऑपरेशन के लिए और आईज की ट्रीटमेंट के लिए किया गया है, हाउ हेल्थ केयर हैज बीन डेवलप्ड बाय दैट कम्युनिटी, दैट वन डॉक्टर टेकिंग केयर ऑफ दैट कम्युनिटी, और सबका एक सब्सिडाइज रेट पे काम करते हैं, बिकॉज देन देयर इज नो मतलब ये नहीं कर सकते हैं कि हमारा कम्युनिटी पर्सन ही हमको लूटेगा. you know that
Hmm.
community itself
Hmm.
has paid that doctor, has funded, and then that doctor is working for the community, is giving back also.
Hmm.
हमको ये सारी जो छोटे छोटे जगहों पर ये जो ब्रिलियंट वर्क हो रहा है कम्युनिटी बेस्ड, वो हमको शुरू करना चाहिए फिर से।
Hmm.
जैसे मेंटल हेल्थ के लिए मेरे पास एक्सेस ना हो सकता है एक थेरेपिस्ट के लिए, मतलब शायद वो मुझे नहीं रीच आउट कर सकते, नीरज को नहीं रीच आउट कर सकते हैं, तो एटलीस्ट हमें एक बेसिक जेंडर सेंसिटाइजेशन प्रोग्राम्स हर कम्युनिटी में एज अ होल हमको शुरू करना चाहिए। एटलीस्ट वो मुझसे नहीं
Hmm.
तो कम से कम कम्युनिटी जो जो ट्रांसमेन कलेक्टिव, हम जो ट्रांसमेन कलेक्टिव है, हम वही कोशिश कर रहे हैं करने की कि एटलीस्ट वी मेक small we are trying to cater, like we are trying to bring uh, more people from grassroots level and try to sensitize them ki whatever needs that trans men community can come with, also understand what they have as a need from different grassroots levels, and then at least start making leaders. You know, I don't want to say
Hmm.
leaders but volunteers, you know, who can at least reach out
Hmm.
um, to the people who are on the uppermost hierarchies, and then matlab, we don't need to have an approach that is top down, you know, we need to have
Yeah.
approach which is collective. So that
Hmm.
I have always bet on community healing than on individual healing, because that has never worked.
Hmm.
And one of the examples is Hijra community. We need to learn from them. You know, we need to learn from Vyjayanti. We need to learn from Neeraj. We need to learn from more people, you know, who are working
Hmm.
on grassroots level, because this knowledge that I have gained today from them is something that I don't think any research can give me, you know.
Hmm.
So I the way these communities have survived, Hijra community, Kinnar community, there are so many more identities that have survived, Kotis, Aravaris, and Aravanis, and so many is something that is a learning for everything. You know? So I feel this
Yeah,
is
it's
what we need.
also, yeah. Yeah, please continue. Sorry.
Yeah. So that is there. And of course, जो हमारे जो privilege, I always want to say that accessing mental health service is a privilege. मेंटल हेल्थ
Hmm.
सर्विस को आज जिस तरीके से देखा जाता है ना, वो बहुत प्रिविलेज लेवल का अंडरस्टैंडिंग है, वेरी वेस्टर्नाइज्ड, वेरी कोलोनाइज्ड अंडरस्टैंडिंग. वी नीड टू
Hmm.
डीकोलोनाइज ऑल दिस, and that
Hmm.
will include one of the steps is community healing, community centers,
Hmm.
support centers, healing circles, support groups. All of these at the whole is very important.
Yeah.
And yes, social
It's
media is one of the ways that you can use. And awareness
hmm.
programs, and ये गवर्नमेंट की तरफ से लेना चाहिए. हम सारा ही
Hmm.
कुछ एक प्राइवेट सेक्टर पे नहीं डाल सकते, बिकॉज प्राइवेट सेक्टर विल
Hmm.
ऑलवेज कम विद कैपिटलिज्म, always will come with
Yeah.
profit base, always will come with business orientation. So we need to do this
Hmm.
as a social responsibility than a capitalist product, because nowadays
Hmm.
therapy is also becoming capitalist product, which
Yeah.
I'm majorly against. So healing things like
Hmm.
and again, I'm so sure that Hijra community and all these communities are doing is also supporting each other. Like, I may not know what it is to be a trans woman. I may not know what
Hmm.
it is to be a intersex person. तो ऐसे जो communities ground level पे काम करते हैं are a huge thing, you know, are a huge pillars of uh, of survival, of support, of mental health support, of physical health support, of family support. So I think all of these needs to be more encouraged to be built. Like, are you getting the point? Am I
Hmm.
answering your question? I mean, this is not very straightforward
Yeah,
answer.
it's not, I mean, there cannot be a straightforward answer to that question. So,
Yeah,
what I'm trying to get is like, it's like to have a belief, on the community and it's
yeah,
somewhere a responsibility of the members themselves to make sure that the people who are entering or the people who are at the margins are able to bring make that build that trust over the people
yeah,
who are somewhere
yeah,
in the
yeah,
who are
yeah,
at the leadership point, who are at the leadership position.
yeah.
So yeah, thank you for
Yeah.
bringing that up. And like yeah, I'll just hand over to
I want
Raju.
to say something.
uh,
Actually.
yeah,
Yeah,
please
just
go
one
ahead.
minute.
Yeah.
I would want to add. By community, I don't mean only the community of like transgender people, or intersections. I
Yeah,
want to say
yeah,
community as a
yeah,
human, not only
yeah.
as intersection. I want to here
Hmm,
say that cis people, very important, they're
hmm,
so privileged and so unaware. So as a human
hmm.
being is something that we need to understand and recognize that privilege and build community as and I always say at these times when we are not able to go out because we are immune compromised, as all of us here will
Hmm.
agree. So it is the duty and the responsibility, which I also said yesterday, that cis people should go out and help us. Need to, they have to
Yeah.
take the ownership. People at non-intersections need to take
Hmm.
the advantage of their privilege, go out, get medications, get whatever we need, open their doors, and then we can stay safe. If we are living in violent houses, abusive homes, they need to open their houses for people like us, for people at
Hmm.
intersections, no matter what. It doesn't have to be gender intersection, intersections across, you know. So by community, I mean
Yeah.
everyone. Like community, like just say I stay in Mulund, so Mulund ka community. Like we have our Gujarat,
Hmm.
like we have a community of caste, So those community people need to take care of it. My building may have
Hmm.
small community. They need to help me.
Yeah.
My society, my local doctors, my local gynecologists, my local doctor medical community, my local mental health community. So that's what I mean to say when I talk about community, not only the
Yeah.
transgender community. I want to say that
Yeah.
this
Thank you
is
for
overall.
yeah. Thank you for clarifying that. Raju, would you like to go ahead?
I was on mute. Sure, I'll take over the next question. So, going ahead with the conversation that we just had with Aryan, this question is addressed to Neeraj. So, access to medical procedures and treatments isn't what it used to be in the current times. And when we look at the economic as well as sociological or the cultural impact that we see, um, and like on the members of trans community. So, can you explain how best allyship, community support practices, all of these could ensure trans youth, which are already a vulnerable subset of people at risk, how can they handle it better?
Cool. Thank you, Raju. So I think I've been like thinking, and I think it's a very quick pointers. I think please fund, organizations or donate to the community-based organization. Please funds to a lot of money to Vyjayanti's initiative if you have, or give it to people. That's very much needed because these are the folks those who are doing on ground work. So and money is needed. So please fund as much as funds you can give, or if whatever your friends to support or something, please if you identify as this person, then if you think that you can negotiate, you have rooms with yourselves, please be available to your trans friends, just to in terms of it, they need rescue or something, please. We need actions. We don't need anymore just talks by the allyship or community support. What I think Aksa, what she spoke about in terms of the Delhi riots, like the food and everything. See, this is a very needed thing. Is it's costly. It does go money into all of these things. So please support in that way. If you have information, right, in terms of, if people, those who can support your trans friends in terms of mental health professionals, health, please take a lead and tell them that it's great if they access it or not, but just don't impose them. So I think these are the things I'm just thinking, that to be with your friends and provide them as much as support you can, but like a tangible support. Just don't like it always, somebody just doesn't want to talk all the time. And and we know with the trans young people also, non-binary folks, they are resilient, they know their issues. Sometimes they are just looking for the opportunities, just to like do something more of it. So if you can support in that way, it's great. uh, be there for them. So yeah, these are the things that I think is just coming to me in my mind, like just quick pointers that I would just say that go for it. Yeah. And did you ask anything else also, Raju?
No, I think that was about it. Yeah. Thanks, Neeraj. for clarifying these points. I think, yeah, it's not just words. I think right now actions matter more, and yeah, funding is a major source of concern for most of the organizations who want to work better.
And I think I'll say once again, because Vyjayanti has just come. I don't know if Vyjayanti listen. Please give a lot of money to Vyjayanti's organization. Please, guys, please.
Yeah.
Yeah.
I don't know.
Thank you for bringing it up.
I know, fund, good initiatives. Don't give it to stupid initiatives also. Please give it to CBOs. So please give it to people those who are working on the grounds. Money matters there. Please do that here.
So yeah, the next question is addressed to Vyjayanti, and because I mean your work is very much on the is very much based on the field, and so how do you see the power structure that needs that which is operating where family is assumed to be a safer space? Vyjayanti, can you hear me?
Can you hear me now?
Yeah.
Okay, before I answer that, I just need to correct a small thing. I don't have an organization. I'm just a Das Rupai Wali RTI activist. All my art activism is through RTI, Right to Information Act. So the fundraiser that I shared is a fundraiser for the mother of a deceased transgender person who was allegedly brutally murdered. So it's not any organization. The bank account there, mother's bank account. So all we're doing is just passing it around. I also I am not organizations are necessary, but also believe that a lot of activism can be done even without organizations. RTI is one of the many tools. And personally, I've chosen to do it through RTIs and precipitate public interest litigation through pro bono lawyers. I don't pay them a rupee. They're already funded. Now, coming back to your question, I forgot your question. I'm sorry. Very quickly, very briefly, would you repeat the
Okay.
question?
Yeah, I'll just repeat it. So, I was just saying that you are part of community-based, like you work as a community worker, your major work is related to you're working on the field. So, how do you see power structure that operates where family is assumed to be a safe place?
Hmm. I I don't know. I think families as institutions have institutionalized many things apart from those over and above those traditional. I don't know if it is over and above or apart. Uh, I'm
Hmm.
reminded of Ambedkar, Gandhi, and Nehru. Village for Gandhi uh, was a smallest unit of self-sufficiency. He spoke of village as a place of cottage industries, a place of dairy farming, agriculture, traditional methods, all of that. Nehru didn't
Hmm.
look at a village that way. He looked at a village as a space, the smallest unit of backwardness, where there is illiteracy, where there is lack of, where there's superstition and all of that. Ambedkar found village as the smallest unit that institutionalizes structural violence. So so, family has meant different things to different people, and for many, I can't speak on behalf of everybody, but I can speak for myself. And for me, I wonder because when children, when people clamor for parental acceptance, and it is but natural for anybody to want their parents to accept them, but we must also be mindful. And I'm just giving an example of perhaps not of corrective rape, but of fairly privileged families where children are fairly well to do, they're abroad, they're doing fairly well, and parents are unable to accept them and want them to get married to the opposite gender. These could be a bunch of gay men who are NRIs or income receivers and so on. But your parents too are conditioned by society. They could be guided by religion, and as per their interpretation of religion, it is not okay to be something, and the change has to come from within their parents. Our lives must not be centered around what alone about what our parents think of us. Our parents are independent beings. When they wish to change, they will change. But this is the
Yeah.
least violent of these examples. When it comes to corrective rape, just some time ago, I was researching on conversion therapy, reparative therapy, which is many names: conversion therapy, reparative therapy, and so on. And I was lost if I was researching on reparative therapy, conversion therapy, or if I was researching on corrective rapes, or if I was researching on caste based sexual violence. Because there's this practice of getting people married within the family, get the child who they've raised as a daughter married to the mama or to the baba. Baba is a Telugu word which means the paternal aunt's son, so as to avoid dowry,
Hmm.
so as to have property within the family and so on. And if that child who has been raised, if that person who's been raised as a girl child who doesn't necessarily identify as a heterosexual or cisgender heterosexual person, self-identifies as lesbian or as a trans man, there is corrective rape sanctioned by family. अरे वो सुन नहीं रही है, जरा जरा ले अंदर ले जाके उसका अकल ठिकाने लगाओ. So is this what
Hmm.
a family is? If this is what a family
Yeah.
is, then sorry, I don't need that family. Good riddance of bad
Yeah.
rubbish.
Yeah, thank you. Thank you so much for like just putting it out so clearly that like family as an institution may not work for everybody in the similar function in the similar way. So thank you so much. Raju, can you, yeah, please go ahead. So Neeraj had to leave, but we
Yeah.
still have Dr. Aqsa, Aryan, and Vyjayanti with us. So can you address the next question, please?
Yeah, and the next question is addressed to all the three panelists. There is a divide between private and public healthcare systems, as we've already been discussing throughout the call, irrespective of COVID times. This impacts the stability in.
Raju, you have muted yourself.
One second. Yeah. Am I audible now? Uh,
Yeah.
yeah. So this impacts the stability in queer support systems, especially when displacement happens. So what exactly is your impression on that?
I'll start so that I can be brief. Especially when we are speaking about the gender affirmation services, and this I also mentioned during my talk, the Insta Live, that most of the gender affirmation services currently are available in the private sector, right? I would say more than 90%, and there are only a few government centers who are doing, let's say, minor surgeries, or only prescribing hormones or some therapy of that kind. But predominantly, the gender affirmation services is in the private sector, and of course, these are for-profit corporate hospitals or solo practice doctors, who are involved in it. Now, I don't want to thanks the Transgender Act, but then thanks to the Transgender Act and the transgender rules and the clause in it which says that all the government hospitals are supposed to be providing gender affirmation services, in every district, ideally it should be present, and also that was some kind of a legal backing available to demand gender affirmation services even from the government setup or from the public healthcare. But unfortunately, due to the COVID, even the non-COVID services, which have nothing to do with the gender affirmation services, something as simple as treating a heart attack, or treating cancer for that matter, has taken a back seat. Most of the hospitals are converted into COVID dedicated hospitals, and this has, I would say, given them a reason or even an excuse to not implement the gender affirmation services, or even think about implementing gender affirmation services in the public sector. So for all practical purposes, the gender affirmation services almost never existed in the public sector, and I don't see them becoming available and accessible in the public sector at least for the next 2 years, because it's a long trajectory, to start rolling out these services in the government sector. So at least for the next 2 years, I don't see that happening. And yes, a lot of displacement, which has happened, like for people have gone back to their hometowns, or universities have closed and they're all online now, and that has led to disconnect in the gender affirmation services vis-a-vis appointments with the doctors, or getting as simple as blood tests done. So for example, there were people who were residing in cities because of their university admissions. They were in the hostels and they could access mental health care services, counseling services, visit an endocrinologist and get some kind of medicine. And then all that has become very difficult. Now they are back into their natal families and are staying with them and are dependent on them, even monetarily for that matter. So it's a bleak future when it comes to the public healthcare sector providing these services. But the private sector, which is driven by the profit, is doing what it has to do. Yeah. But again, the capitalism trap.
So rightly said, Dr. Aksa. So I think it makes true sense that not nothing would appear so soon, or even it'll take a lot of time before we can actually see changes in the public sector. Yeah. Any thoughts on that, Vyjayanti and Aryan?
Aryan, do you want to go first?
No, no, go ahead, go ahead. I'm still thinking.
Okay, okay. So, yes, here in even before COVID, while there was no transgender policy or government order implementing the Nalsa judgment, the Transgender Act and its rules came into force only during COVID. The rules came into force only during COVID. But before that, in the public sector, when I went to get my gender dysphoria certificate from a government hospital, by then I had already got it from some leading private hospitals. I had got it from Apollo, and when I came to Delhi, I got it also from Fortis. So I had two private sector hospital gender dysphoria certificates, but because I had no clue what the rules and the Trans Act would say, if it would mandate a government hospital gender dysphoria certificate, I wanted to be on the safe side. So I went to a state government hospital, which was very clueless, which sent me, I'm going there for a gender dysphoria certificate. So they sent me to another government hospital, which is this government hospital was for mental health. It referred me to another full-fledged government hospital for my blood tests, my urine tests, for my, to denude and examine my genitalia. To also sent me to the Center for Cellular and Molecular Biology. For gender dysphoria certificate, they sent me to the Center for Cellular and Molecular Biology for my karyotyping. So this approach to play safe, government officials are already always very scared of how things will go against them. So they try to play safe, and that approach to play safe and to have all documentation, whether or not necessary, is very traumatizing for trans persons. So I'm just waiting for these places to start their services again so as to do some test pilot projects with people who wish to volunteer, and to test their boundaries, and then engage with them, write representations as to what is necessary. And then I'll come to you, Dr. Aqsa Shaikh, because you are our trans person healthcare professional. So so and to get those structural corrections done. Now about private healthcare, I haven't really dealt much with private healthcare. I am a votary of that healthcare and Medicare should largely lie with the public sector. Of course, there should be a private sector, but the burden should be more on the public sector. It's only then that, and it should always be compared with the private sector for it to have its quality standards in place, and vice versa. So I really don't know much about private healthcare. I have almost always guided people to public healthcare because bulk of the transgender hijra kinnar communities are not so well off so as to afford private healthcare. So we should also think of PPPs, public-private partnerships, wherein it is affordable. we get the best of the both, and again, nothing is so binary. So I think we should imagine beyond the binaries of public and private healthcare again, because nothing is binary. Look at PPPs, look at newer models, and subvert capitalist paradigms. I'm done.
I absolutely agree with Vyjayanti. I agree with actually both of y'all because like I always said that, in my experience, what I have faced or what I have seen people doing is gender dysphoria certificate or it's a letter of support. Now that we call it is letter of support. Um, one privatization of these facilities, I think, is unfortunate because this is such an essential thing. No? That's what I always say that first thing that needs to come into the perspective is is the government knows or understands that these are essential needs and not a selective or elective. You know. Um, and hence and when these come as like how polio, and that's the last example that I need to give to that, but unfortunately I know that is the only thing is what I'm aware of. मेरा गलती है मुझे ज्यादा अवेयरनेस नहीं है इस चीज को लेकर बट ये सारी चीजें जो फ्री में दी जाती है इसी तरीके से हमारे सर्विस भी है हमको ये सर्विस फ्री मिलनी चाहिए we need to get these we need to have these things as free. It needs to be taken up by the government, and even if it is private, then it needs to be affordable because I have seen people, I have personally gone to government hospital to get my own certificate. So it just cost me 50 rupees. That is like I went for 4 or 5 times and I need to give 10 rupees every time. Now that's what I also want to here bring into picture is the certification in itself is an act of oppression, you know, because like no cis person has to define themselves or need a letter of support to say they are cis. In the same way, trans person doesn't have to say or prove themselves as trans. That is my first take on these practices in itself. So when these
Yeah.
are seen as a basic understanding of a gender, of gender, and hence I always say gender education is utmost important to take away the stigma because the whole idea that is coming up that I need to prove and I need a letter of support in itself is a trans negative idea, you know,
Hmm.
it's an oppression. So first thing is this needs to be out. That I do not, and none of us needs to prove who we are. Yeah, that is
Yeah.
one. And I know this is
Yeah.
quite
Totally.
ideal, but I want to say this is not ideal. This is factual, which is currently cis people making it look like ideal. You know, this is not like
Hmm.
not possible.
Yeah.
You know, so this is what is the first thing that I want to say is you do not like none of us need to prove ourselves as trans. But now, unfortunately, that we have
Yeah.
to, then these services needs to be free of charge. Definitely, because we need to here understand, and I know the kind of malpractices that is happening around. I want to bring this up here. I know people charging 5,000 rupees for the letter of support and doing testing like Rorschach. And I am coming from the mental health background, so I know those tests do nothing. They are they have no they have nothing to say on gender. They cannot, nobody can define your gender. By taking those tests itself, those tests are oppression on us. Does any of cis people have to go through tests to define that they are cis? Then why do we have to? That's what is heartbreaking for me. That's where the first oppression starts. When I have to be validated by a cis person, a test developed by cis, a test who's taking is a cis, who I need to prove is a cis person. Why?
Hmm.
You know, I'm totally against the letter of support or a certificate of gender. Absolutely against, and I want to make this stand absolutely clear, in this panel discussion. So that is one. Second,
Yeah.
that now if this is something, these malpractices are still happening, I would call it legit malpractice is happening, then please make this free of charge. Absolutely free of charge. So everyone from any social economic location can avail this service.
Yeah, thank you, Aryan, for bringing it up and like really, throwing a light, like,
So
yeah,
sorry.
this is something that this is not needed at all. And I'll just
Yeah,
put the last question. I mean, we had more questions, but we are really short
sure.
of time, and we have
Yeah.
actually
My
exceeded the
apologies to
time.
interject. My apologies to interject. I am so
No,
inspired by this
yeah,
discussion. I have goosebumps on my body. I am so blessed. Feel so blessed to hear Dr. Aqsa Shaikh, Aryan Bhai, and Neeraj Bhai as well. So
Yeah.
I would urge Aryan Bhai, Dr. Aqsa Shaikh, please implead if you find if you can do please implead
Mm,
into the constitutional challenge to the Trans Act for it to be recast and reframed because you bring in very different perspectives. We've already completed. There are just three
mm,
batches there, and I won't take more than half a minute more. My apologies, Abhiti
mm,
and
yeah,
Raju. Yeah, so right now the first challenge is from Swati Bidan Barua, represented by Anita Shenoy, Senior Counsel. The second challenge is Grace Banu and others, where I am one of the
mm,
petitioners, represented by
oh,
Jena Kothari, and the third is Racharam Mudraboina and others, represented by HRLN, Colin Gonzalez. And all of these are trans women. There are some trans men. But Aryan, your perspective, Dr. Aqsa Sheikh, your perspective as mental health care professionals, as healthcare professionals, as Medicare professionals, you, Dr. Aqsa Sheikh,
mm,
these are priceless. These are invaluable. Somewhere it'll be lovely if a group of transgender mental health professionals come together,
mm,
or queer trans mental health professionals come together and implement, and also a group of Medicare trans professionals like you, Dr. Akhtar Sheikh, implement. It would be priceless. And I'm done.
Thanks,
Sorry.
Vyjayanti. I'm already
yeah,
on it along with CHLET.
Brilliant.
great,
Brilliant.
great. Yeah, so my last question is to you only. Vajanti, my last question is to you. So I was basically trying to, because since we're talking about trans youth, and so just to shed some light on what are the legal rights of trans children who escape from abusive homes?
Hmm. Oh God, this is a very vast question. This is a very,
Yeah,
very
but I
vast
mean,
question.
it's okay.
So, uh, well, as of now, many gender non-conforming children who are either thrown out or who escape from their natal homes, many of them, I won't know of all of them, but many of them are the major institutions available are not government institutions. These are the traditional, call them dayars or deras or gharanas or havelis or jamaat in South, in Tamil Nadu and Kerala and Karnataka, they're called Jamaat. In Rajasthan and all those places. Up north, they're called Dayar, Dera, Gharana, Haveli, and so on, have been spaces of support. But in as much as they have been spaces of support, our own institutions, there is violence within communities, and we can't bury our heads into the sand like ostriches. We have to clean up that violence. And if we don't, for instance, there are children, and children do have adolescent sexuality. How do we know that a child who is sexually attracted to men, if the child were to be assigned, if the child was assigned male at birth, how do we know that this 13 or 14-year-old will grow up to self-identify as a trans woman, or as a GNB, GNC person, or as a cisgender gay man? We don't know that yet. It is for the child to
Yeah.
figure out as the child grows into an adult. And unfortunately, there are occasions. I don't want to paint vast communities in one color, but there are occasions where underage uh, children below consent, children well below the age of consent, purely because they can pass off for people at the age of consent, because 14-year-olds too can grow up to be 5 feet 10 inches tall, right? So are being brought in, and they're being, I don't think it happens like trafficking where girls are thrashed to pulp and gang raped and so on, but it happens differently. So that those kind of structural corrections have to happen. They must happen from within communities. If they do not happen from within communities, if communities do not look inwards, अंतर्गत अगर हम अपने आप के अपने समुदायों के अंदर झांक कर नहीं देख के उस ऐसी कुसंस्कृतियों का सफाई नहीं करेंगे, unless we do that, the state will intervene and it will be havoc. So, be it transgender communities, be it any other marginalized communities, these corrections have to happen from within. And I think our communities have to know their rights and know the rights of children. Our communities are not aware of POXO, they are not aware of juvenile justice boards. There's a lot of work to be done, and your question is very, very vast. I can't really answer that as the last question with a paucity of time. So I'm done.
Yeah, thank you so much. But that's really important, and to like how like to look within the community and see, like reflect on our own and how we can take forward the fight. So I would just request Raju to close and maybe like just conclude the 2.5 hours conversation that we had. That's a huge responsibility, Raju.
Yes, I think concluding such a vast information of knowledge that we've gathered over the past
Yeah.
2.5 hours, I think the amount of information, the
Yeah.
amount of knowledge that we have garnered, and I think the depth of conversations that we had, this has been a great platform for us to be a part of, for us to actually just learn. And I think, yeah, thanks for all of the panelists for individually participating so actively in the conversation, for encouraging all of us to be more active towards this um intersectional space that we are heading towards. I think in the pandemic, where we are lacking optimism, where I think everyone has come to, most of our activists have come to a state of exhaustion. I think such spaces, such conversations are what encourage us to uh, push it further, to make it more, to create a space more safer for the marginalized. I think this has been one such spaces, and if all of this conversation is reaching those people without the access, so those who have not been able to attend live, if they could listen to the recording and benefit from this, I think that would be one of our greatest um, so yeah, I think greatest contributions that we could even think of. Abhiti, would you like to add anything as well?
No, I just want to remind everyone of the fundraise that Vajanti is running for Hamsa's mother. So I just want people to just go ahead and, share it if they can't contribute, but make sure that they are aware of it and they just spread it as much as they can. So thank you everyone for joining,
Five
and thank you
Yeah.
so much for your,
last 5 seconds. The concerns that I raised within communities are only with sections of communities. As I said earlier, I don't want to paint the whole community in one color with one brush, but
yeah.
every community has its own share of muck to clean up. Every community, and so do we. We are not, we're just like anybody else. So I just wanted to issue that clarification.
Yeah.
Thank you. Thank you.
Yeah, thank you. Thank you for doing that. But thank you so much for participating and making sure that your understanding and your reflections are spread out and just really putting a lot of effort in doing that. So thank you so much. We really look forward to like remain in touch with you and make sure that we continue having these conversations and they do not limit to just a month or to a week, just to make sure that things continue to happen and these conversations never stop. And we really reach to a point where where we really are, where this ideal world or this ideal situation that we look to, we're able to reach there and make sure that things do happen the way we look at them. So thank you so much for participating and sharing your reflections and understandings with us. Thank you so much. We'll share the live.
Yeah.
Hmm. Thank you
I
Yeah,
so
think
we'll
much for
share
this
it on.
opportunity, for this platform. It means a lot to have these platforms where we can speak up what exactly, how, like the information coming from the community itself. I think that's a
Yeah,
huge uh, space that you all created as cis people, or I don't know what you guys identify as, but as as people of community. You know,
yeah.
thank
Thank
you so
you.
much.
thanks a lot.
Love you all to the moon and back. Mwah, flying kisses to all of you.
Thanks.
Yeah, thank you.
Thank you.
Okay. Yeah, take care, everyone. See
Take
you
care.
soon. Yeah,
Stay safe.
Bye bye.
bye.
Bye, everyone.
He's still not able to stop it. Yeah, I can see the screen. Let me. Uh, no. Yeah, remove alphas. Yeah, just stop record. यहाँ पे है ना stop record. There was an option for stop recording. I thought I can. I thought I can do it, but I cannot function on your screen. So you have to do it yourself. Did it stop? No, it did not. Oh God, how will it stop? Because I remember I had just pressed the same button and I don't, the option for stop recording is not coming to me, so otherwise I would have done it. करें क्या करें क्या करें